Hi, my name is Hannah Hill. I am currently a nurse practitioner student at Auburn University. The purpose of this video is to educate and inform the general public concerning nurse practitioner role acceptance and awareness. NPs are clinicians who are considered to have clinical expertise and whose role is as the provider. This is a transition from the role as an RN who can carry out orders and is part of the clinical background of the NP. Most NPs have 4 years of nursing school, followed by 2 to 10 years of nursing experience and 2 to 4 years of graduate training with a minimum requirement of holding a Master's of Science in Nursing degree. Practice requirements for NPs include a bachelor's degree in nursing, registered nurse licensure, graduate nursing education, national board certification, state NP licensure, and registration. The difference between NPs and MDs includes curriculum and approach to practice. The medical model for the MD is focused on a diagnosis and treatment of disease. Alternatively, NPs follow a holistic medical model focused on treating the patient as a whole and not just presenting the disease or illness. Providing care even when the doctor is there. Quality health care has been provided by nurse practitioners for more than half a century now. Although every nurse practitioner can provide quality care independently, currently their practice authority remains divided into 3 sectors, including full, reduced, and restricted scope of practice. Full practice authority remains states allow NPs to practice autonomously within their own practice, but states with restricted authority like Georgia, where I was born, raised, and currently live, requires NPs to work with a collaborating physician under the Advanced Nurse Practitioner Supervision Policy, requiring a collaborative practice agreement. This is a written statement that defines the joint practice of a physician and an NP in a collaborative and complementary working relationship. Additionally, it frequently includes the responsibilities of both the collaborating physician and the NP and often defines the prescribing authority of an NP. We're here and there, we're everywhere. NPs can be found in primary, acute, and specialty care settings of any size. Currently, NPs make up the largest percentage of primary healthcare providers in rural and underserved communities. In 2017, 87% of NPs were prepared in primary care programs, with only 14.5% of physicians entering primary care residencies. Access to high-quality, cost-effective, and accessible patient-centered healthcare is being expanded to millions of Americans living in these communities by NPs. Doctors and nurse practitioners serving side by side a multitude of services we provide. NPs, much like physicians, can provide a full range of primary, acute, and specialty care services. This includes assessing the patient, ordering and interpreting tests, making diagnoses, and providing acute and chronic treatment. 60% of NPs see 3 or more patients per hour. Their practice approach is a comprehensive model that's supported by the NP's nursing background that encompasses a holistic approach. On a 1 to 10 scale, our ratings prevail. NPs continue to receive high favorability ratings and positive feedback concerning listening to and spending more time with the patient. In fact, studies show that patients' outcomes between physicians and NPs in primary care are not significantly different and are equally safe and effective providers. Furthermore, healthcare costs is appreciably lower with NPs versus physicians, aiding in cost-effective care and almost certainly a key reason that patients choose NPs. Reports by the AANP state that malpractice rates remain low amongst NPs. Only 1.9% have been named as primary defendants in a malpractice case. It is important to note if a patient does desire to see a physician rather than an NP, the physician must be available to see the patient and provide care. Most frequently asked and point of hesitation, yes, we are able to prescribe medication. NPs are licensed in all 50 states to write prescriptions, including controlled substances. In restricted practice states, nurse practitioners cannot write controlled substances without a collaborating physician, but those who obtain a DEA license can prescribe for levels 3 through 5 controlled substances. Number of primary care physicians may now be low, but our NP community is continuing to grow. Since 1999, the number of NPs has increased from 68,300 to 248,000, with 23,000 NPs or more graduating each year, while there is an annual primary care physician shortage of 8,200 each year. The climbing number of NPs will assist to fill the gap, offsetting a dangerous shortage in primary care providers. Specialties, although not rare, NPs continue to choose primary care. Despite the vast array of interests and specializations amongst providers, 90% of graduating NPs are specializing in primary care. All of the doctors, we need these guys, but the workload is large, so NPs are on the rise. The necessity for primary care providers in rural and underserved areas is the foundation of the role transition and formulation of RNs to advanced practitioners. NPs are currently the fifth most in-demand healthcare specialty and have experienced a jolting 320% demand increase in the last 3 years alone. 50 years in the making of the practitioner endeavor, their role now is more important than ever. Due to aging baby boomer population and an increase in individuals newly insured under the Affordable Care Act, healthcare will experience an influx of millions of patients. According to the AAMP, 1 in 5 Americans will be 65 or older by the year 2030, with 60% requiring treatment for at least one chronic condition. Did you wait long hours, couldn't get in? What an asset the NPs have been. The expansion of the NP role into primary acute and specialty care, as well as retail clinics, has served the healthcare population immensely. NPs make up 95% of the provider population in these settings, staffing more than 2,000 retail clinics that serve 35 million patients alone. NPs also accept at least 80% of Medicare, Medicaid, private insurance, and uninsured, making them more accessible to those wanting to establish care or those seeking immediate treatment, and decreasing waiting times and delayed care for patients. It's all important, the whole of you. Keeping you healthy is what we do. My main takeaways for the NP are their comprehensive practice methods with goals of care throughout a holistic approach. It's not only important to treat the patient physically, but also emotionally and mentally. The body works as a whole, making holistic treatment approaches highly effective and producing improved patient outcomes. The NP as a provider is as safe and effective as an MD, are available in vast array of settings, can prescribe and order medication as well as treatments, and have high satisfaction rates amongst the patient population. If you are seeking a primary care provider, an NP is an excellent option for you. Although barriers still exist limiting scope of practice, 2 out of 3 patients support legislation for greater access to NP services, lending to a probable future increase in NPs who are the solution for a growing need for healthcare providers, especially in primary care, who can provide patient-centered, accessible healthcare.